Welcome back to Beyond the Stethoscope, where we explore the people, innovations, and stories shaping the future of healthcare in the greater Philadelphia region. At Trinity Health Mid-Atlantic, the commitment to delivering the highest quality of care is deeply rooted in the mission, and that includes staying at the forefront of medical technology. In this episode, we are joined by Dr. Oleg Teytelboym, who gives us an inside look into some of the most advanced CT technologies now being used across our region. From faster diagnostics to greater precision, these innovations are transforming the way we care for our communities. Dr. Teytelboym, thank you so much for joining me today.
Thank you for having me.
I'm really looking forward to learning a little about a topic I don't know very much about. So I really appreciate your time, and I know you're a very busy physician. So for you to come out here and have this chat really means a lot to me.
No, thank you for having me. I'm very passionate about the technology. I'm very proud to be a member of the Trinity and Mid-Atlantic community. So I'm very, very excited to share what we have and what we can do for our patients and how we can answer the questions that our doctors have for us.
Perfect. Thank you. Well, so if you don't mind, if we would just get started at your history, what brought you to Trinity Health Mid-Atlantic? How long have you been in this role?
So medicine has been very, very exciting for me. I'm actually an immigrant. I grew up in former Soviet Union, my family immigrated, so I ended up in New Jersey. So it's really exciting doing a little bit of loop around the country and coming back. So I've came back to this area and to Trinity in 2009, where I originally joined as a residency program director at Mercy Fitzgerald Hospital. So my job was to be a clinical radiologist and to train doctors how to become radiologists. So it really seems like yesterday. The time has flew by and things have been very, very exciting. So I have been at Mercy Fitz for a number of years, but the current chapter is even more exciting. So working with my colleagues at Fitz and other radiologists in the practice and with a partnership with the health system, we have created a new practice that's now 1 year and 1 month old, where our new practice is now working across Trinity Health Mid-Atlantic, providing radiology services at St. Francis in Wilmington, Mercy Fitz in Darby, Nazareth in Philadelphia, and St. Mary in Bucks County. And we've been able to attract the best radiologists in the area to join us to do this. We are committed to taking care of the patients, teaching our trainees how to become radiologists, recruit some of them back. Actually, I'm just very, very excited that the 3 newest radiologists that have joined our practice, 2 of them are our own graduates. One of them just finished, after graduating, finished a fellowship in neuroradiology at Yale. Another one of our graduates just finished a fellowship in body imaging at Brown. And the third one just finished a fellowship in neuroradiology at Penn.
Wow.
So we're very excited to have them as our additions to the family. I mean, all of our last year's graduates right now doing fellowships at Penn, and one of them is already coming back to rejoin us next year.
It's so wonderful because, in your 16-year history, just seeing people come back with incredible talent like you have and keeping it in this region is so important. So in regards to your history with, your expertise, right, in radiology and CT imaging, can you tell me a little bit about the evolution of CT imaging as you've experienced it in your time in this field?
So CT is, when we think of radiology, CT is probably the most important innovation. It was the quickest Nobel Prize awarded in medicine was invention of CT and how to reconstruct the images. But it really has underwent a complete transformation in the 2000s, where we went from really slow machines that took an hour to get a small image to much faster scanning. And it really evolved, and the evolutions have sped it up as the computers became faster, the technology has improved. And one of the biggest innovations in CT of the last 2 decades is not only just better, faster, more precise, but it's really addition of multi-energy CT. So ultimately what CT is, it's the same thing as William Röntgen discovered when he x-rayed his wife's hand. No radiation protection in those days. We do a little bit better now. So it's an x-ray beam, and CT takes the x-ray beam from every direction. So it's a 360, and then using advanced mathematics, computer reconstructs a 3D image of that. Wow. And that's really been the foundation. So trying to do it better, faster, and more accurately. But multi-energy CT adds a new dimension to that. So it uses beams, X-ray beams of different energy. It's, on one hand, what does it do? But what turns out is different parts of the body and different tissues absorb that energy differently. So we're able to do something called material decomposition. Not only we can assess and reconstruct 3D pictures, but we can actually figure out what is certain parts of the body are composed of. So I can give you an example. Let's say a kidney stone. So we see a kidney stone, we tell our referring clinicians, urologists sometimes will have to put a stent, sometimes have to do lithotripsies, get those stones out, complicated procedures. But a small subset of those kidney stones are composed of uric acid. And those stones are treated with medications, and they can be cured with just medication. So the only way to identify that is by getting rid of the stone until multi-energy CT came along.
Incredible.
And with multi-energy CT, I can actually tell what that stone is composed. Is it calcium or is it uric acid? So we don't need to try to get that stone out. I can actually tell the referring clinician exactly what it is. And this is just scratching the surface. I mean, medicine has changed a lot. A lot of patients have metallic implants. Those metallic implants create a lot of artifacts, but using multi-energy CT, I can make those artifacts go away. Other applications include contrast. So we use contrast to identify areas of inflammation, infections, tumors, because they take contrast. But to make those images more helpful, before we used to do CT scans first without, then with. And that doubles the dose of radiation because you have to scan somebody twice. But using multi-energy CT, we can actually identify the iodine molecules and use mathematics and physics to subtract them. So instead of doing 2 scans, I can do a single scan and subtract to make the iodine brighter at will. And to me, this has been an incredible innovation, and that has been, the images are just so much easier to interpret. It has caused it has enabled us to significantly increase accuracy. We're able to diagnose smaller cancers. We're able to more accurately differentiate what is cancer, what is not, especially for small lesions in organs such as kidneys or liver. Before, we'd have to do additional tests, but using multi-energy CT, we can tell right away.
I had no idea this was the background. Actually, I have a family member going through malt lymphoma, and it was, I think it was a 1-scan deal, which we were also thankful because your eye area is, so sensitive and around, the face and head and everything. So thank you for that. I already feel like I'm learning so much, and I want to bring it to our hospital group because I understand that St. Francis has a specific I guess it would be called a machine. I'm sure there's a more official name for it, but that is being used in 1 of 7 hospitals in the United States. Can you tell me more about this machine?
So this has been a really exciting journey, and this is what I really appreciate, and this is working in Trinity and with Trinity, is because of the size of the organization, we're able to access some of the most innovative technology. And Trinity has been able to leverage that, working with international vendors such as Siemens to keep us at the forefront of the technology. So at Mercy Fitzgerald, we have been using dual energy CT for a long, long time. We have been doing research, we have been speaking, publishing, writing a lot of articles. And as a part of the regional transition, as we were planning for that with regional health system, we we have tried to make a map of what do we need to do to deliver cutting edge at all of our hospitals. And for St. Francis specifically, it needed a new updated CT scanner. And rather than just getting something that's average or run of the mill, we wanted the best of the best. So working with Trinity and working with Siemens, Siemens has just come out with a new generation of dual energy, dual source CT scanners that do this a little bit better. So they do it a little bit faster, a little bit more accurate. The images are a little bit prettier. And working with Siemens, we were able to get one of the very first machines in the country.
Incredible.
So this is number 7 installation in the United States. And the first, the first machine of that generation or that capability in the entire state of Delaware.
Incredible. That's
one of the
accomplishment.
Most innovative CT scanners in the tri-state area. So we were extraordinarily pleased that we were able to bring this. And it actually, because of the capabilities, the machine is a little bit smaller, a little bit easier to operate. So we were able to place it into our facilities and really replace what is average with the cutting edge for our population. And that really has enabled us to offer some of the most cutting edge testing and radiology. So for example, that plays a big role in diagnosis of trauma patients, in diagnosis of stroke patients, and in diagnosis of heart disease patients. So these are the big issues that affect the population that we serve in Wilmington. And the ability to perform fast CT scans, but especially ability to perform CT scans with multi-energy reformats really improves the care of stroke patients.
Absolutely. When it comes to, let's say, a patient's experience from their comfort level to also, I think you've touched on this, but the faster results, how does this new imaging play a role in that?
So the easiest example, when we're dealing with a trauma patient, and same rules applies for non-trauma patient. The faster the scan, the better it is. And all of us have experienced getting an imaging test when we're told, hold your breath.
Right.
You hold your breath.
Don't move. Yeah.
You hold your breath. You do your best. Then you take a really small breath and you're like, oh, hopefully that was okay.
Right.
And then they get to you, no, let's do it again. So ability with this machine to scan the entire body in a second, we no longer have to tell our patients to hold the breath.
Awesome.
We can actually scan so fast that
in between breaths.
In between the breaths.
Right. And like you said, for someone who's just undergone trauma, like, when you have somebody in, just being able to get that data and still have their comfort top of mind is really important.
So I remember when I saw the first prototype in the United States for that machine at NIH before it was clinical. I was giving a lecture on adrenal imaging, and they said, by the way, let us show you, this is what Siemens just brought us, and it was at the NIH hospital in Bethesda. What I remember from that is the table was moving so fast that I did not understand how the patient didn't fall off. Wow. Well, now that we're a little bit further along and now the table is even faster and the machines are faster, now that we're actually using this clinically, I still don't understand how the patient does not fall off.
It's amazing.
It really moves that quickly. I tried it myself. You really don't notice, but it's a blink in the eye and the scan is done. In fact, the machine is so fast we can freeze cardiac motion with it. And this is what enables us to scan the heart and to use this technology to prevent heart attacks and diagnose them earlier. Right. So if we can freeze respiratory motion, we can freeze cardiac motion. So the key innovation that scanner has actually 2 tubes that generate X-ray beams. So you scan significantly faster because of that scanner's capability. So literally, in the blink of an eye, The scan is done, and we have the answer. So when we're able to freeze cardiac motion, not just respiratory motion, we can scan the small vessels in the heart. And the biggest advantage is for speed, well, comfort number one, but the speed and accuracy of the diagnosis. So, for example, when a patient comes with chest pain to the emergency department, often doctors think of three things first. First is a heart attack. Second is a blood clot in the lungs, a pulmonary embolism. And third is a tear in the aorta or aortic dissection. And if we go back 10, 15 years ago, you would need three different tests for each of these to separate. So we'd guess which one's first, we'd look for it. Yes, okay, no, move on to the second one. No, move on to the third one.
It's like kind of a shot in the dark. And you're talking about time, if you have somebody that could be in an active, need for intervention.
So, and sometimes the time could be measured in hours, sometimes in days.
Exactly.
And this type of machine actually enables us to do something called a triple rule out, where because the scan is so fast, we can look for three of those things at the same time, where we can freeze the cardiac motion, we can freeze the respiratory motion and the aortic motion, and look at all of the three sets of the vessels. And that really makes an enormous difference. And sometimes we diagnose a heart attack by EKG. Sometimes we diagnose it by a blood test. But sometimes neither of those is conclusive. And actually, just yesterday, I'm looking at the scan of one of our patients admitted where doctors really thought it was a tear in the aorta. EKG was inconclusive. We were scanning so quickly, the lab tests haven't even come back yet. And as I'm looking at this, well, it looks like every vessel in the heart is actually occluded. So the patient is experiencing a heart attack. So we were able to get a diagnostic jump start much, much faster, as opposed to waiting for other tests or follow-up tests to come back, which sometimes takes hours.
That's like what you said, and those hours could be crucial. Before we wrap up today, I would love to ask about your future looking. So when you look at maybe, let's fast forward 10 years in the world of CT imaging, what would you like to see? What do you anticipate seeing?
So the next innovation that we have been able to do, and as that new machine at St. Francis was the beginning, is look at the data. So the CT scanner generates enormous amount of data, and a computer that's attached to it is only able to do so much to process it. So what we have just rolled out after installation of the CT is a super advanced cloud server. Again, working with Trinity and Siemens to stay at the cutting edge. Actually, this was just released by Siemens in January.
Wow.
So I don't know. We may actually be the first ones in the United States to get it, I think. But this was a worldwide release. And what it does is it takes the data from the CT scanners, and this is now applicable to every single machine we have in the region. So we have the dual energy platforms at all of our 4 hospitals. So as the data is acquired, it is reconstructed in the machine locally, but also sent to the cloud server. And the cloud server does a lot of automated reformats. So subtracts iodine, makes iodine brighter, creates 3D reformat, creates auto vessel tracking reformats, creates perfusion data. So now when I'm looking at the CT images, I don't just have the 2-dimensional or even 3-dimensional. Now I have multi-dimensional, multi-energy reformats. So as makes me faster, makes me much more accurate. So what we are using is cutting-edge computer, cutting-edge cloud, and cutting-edge AI technology to be able to get a lot more out of the data that we're doing and deliver it a lot faster. So we're able to have the diagnosis faster, more accurately, and adding multiple dimensions. And the platforms that we are on, and there's a reason we went on them, is naturally enable themselves to the advances in AI. And as the new tools will be rolled out from the lab into the clinical arena, we are positioned to be the first ones to take advantage of them, as now having this multi-energy platform at all of our hospitals in the region, we were able to roll out the cloud server to process the data. And now, as any innovation that's created, we will be the first ones to take advantage of it and make it available for our patients and our doctors. And to me, there is no better joy than to answer the question and help to take care of the patient.
It's amazing. So it sounds like you'll continue to be at the forefront of this incredible technology.
Thanks to our institution, our health system, our colleagues, and just very, very proud and very excited to be here.
Yes. Well, and thanks to you. Thank you so much for your time. I know you're very busy, and being at the forefront of this, it's incredible to have spent this time with you. Thank you.
Thank you for having me.
As we've heard today, the world of CT imaging is evolving rapidly, and it's changing the way doctors diagnose, treat, and care for patients. From faster scans to greater precision, these advancements are more than just technological. They're deeply human, helping to deliver better outcomes and more compassionate care. Thanks for joining us on Beyond the Stethoscope. Don't forget to subscribe and follow Trinity Health Mid-Atlantic on social media to catch new episodes every other Thursday.